It's an honor to be here, and it's great to see so many people interested in health co-ops. I'm going to give you two little vignettes, and then I'd just rather have a discussion rather than talk to you, because I'm not really exactly sure what you're interested in, but I'm starting to figure it out. The reason that I'm here is because I sat in a conference room up on Capitol Hill for 3 months back in the summer of 2009, and there were 6 senators in that room. There were 3 Democrats and 3 Republicans. The 3 Democrats were Max Baucus from Montana, Kent Conrad from North Dakota, and Jeff Bingaman from New Mexico. The 3 Republicans were Chuck Grassley from Iowa, Mike Enzi from Wyoming, and Olympia Snowe from Maine. And they were engaged in an effort to try to craft a bipartisan health care bill. Well, you all know that that didn't work, and that the bill that ultimately passed was voted out with just Democratic votes. However, the bill has a lot of features of those discussions, and the co-op provision is one of those bipartisan efforts that ended up in the bill, despite the fact that none of the Republicans voted for the bill. And what happened was this. There was a big debate going on about whether we should have a public option. You remember that being reported in the press, about whether the government should sponsor a health care plan to compete with the private insurance companies. And a lot of Democrats, particularly the progressive Democrats, thought that was a grand idea. And they pointed to Medicare or Medicaid or other things as successful public programs. But to most Republicans, that was a deal killer. They said, that's not what we need. We don't need any more government-run health care. So the members were sitting around that room, and they all know each other and get along very well. And so they were being honest in discussion, and they said, well, we have to do something here. We can't do a public option. Democrats said we have to do something to facilitate competition. And Kent Conrad one day came into that meeting and he said, I have an idea. Let's do something that is built on an infrastructure that already exists in America. It doesn't necessarily exist in healthcare, but we have this co-op kind of structure that's out there. At least in the heartland of America, where we have a lot of agriculture, people understand co-ops. People understand what they do, that they are there to provide services to their members. They understand how they're governed. They sort of trust the co-op. They've been involved with it in business. And if you take sort of a look at the states that are represented by those 6 senators that I talked about, they all nodded their heads, because they're mostly from ag states, and they sort of all understood that. So after a little work, a little development of the issues that were brought to the table, we came up with this proposal that ultimately ended up in the bill. And we, frankly, were not sure whether it would work at all. But we were hoping that it would, and we were hoping it would provide the kind of bridge that people would say, hey, they're trying something new, let's see if it works. Now, to be honest, we talked a lot with Mr. Morrison and others who encouraged us, but we were not 100% sure this would really take off. And I'm still not 100% sure it's going to work everywhere. And Congress has a bad track record in terms of predicting exactly what's going to happen out there in the market, particularly health care. You may remember the Medicare drug prescription bill back from 2004. And actually a lot of members had concerns about whether insurance companies would actually offer plans in rural areas. And we set up this elaborate scheme that if no one came forward in Montana or other rural places and offered a plan, that then we had to set up a plan. We had to make them offer a plan and all. Well, as it turned out, a lot of these places in rural America have more plans than they know what to do with. The private sector has offered a lot of those. So we don't necessarily know how things are going to play out. But in this context, this idea came from a concern of the members that we need some innovative ways of looking at things and that will work maybe in some areas where other programs that we have in healthcare may not work so well. And so that was the genesis of it. Once it got settled and got in the bill, even though Republicans dropped off the bill, the Democrats liked the idea at that point. And so we moved forward, and it made it through really without any discussion or debate. There was not a big controversy in dealing with the House or President Obama about whether this should be in the final bill. And it's kind of skated along mostly under the radar. That was until this year when we were doing the continuing resolution, and we needed to cut some spending, and some people looked at the $6 billion and said, we really need $6 billion. Well, I don't know whether we do or not. You can tell me how much we need for the grants and loans. But anyway, we decided to cut that back to 3.8. So that's where we are. That's a little bit of the history, and I'm happy to talk about any of that. All of you have surpassed me in knowledge of co-ops since then because you've been working on it, and I've moved on to other things, deficit reduction. The second thing I would just like to mention is that this issue is part of a broader debate that we're having in Congress, not really frontally. It's not a big debate yet, but I think it's an emerging debate, and that is, what do we do, how do we structure our government and our economic system to deal with businesses whose purpose is not to make a profit, okay? And you may say, well, we've had that for decades and decades and centuries. Why? What are you talking about? That's what we have. We have nonprofit organizations. Well, that's true, but in our society, it's becoming clear to me that the line between profit and nonprofit is starting to blur a little bit in a lot of places. I mean, we have some industries where things have evolved, and so we've got banks that are taxable and credit unions that are not. But in a lot of areas, things are kind of in between. I had the CEO of Newman's, Newman's Own Dressing came in, and then he presented sort of what their goals were, and I'm like, are you a business or not? I mean, I'm not really sure whether do you want to sell salad dressing or not? And really, they don't. They want to sell salad dressing. That's not their goal. Their goal is all of the social charities and other things that they really want to help. And this is just a means of doing it. And so we get to the point where we say, okay, how should we organize, and from my committee's perspective, how should we tax these organizations? Co-ops are tax-exempt organizations. They have all these rules that you have to follow to make sure you don't violate those rules and become taxable. We have C corporations, which we clearly tax, although they get credits and deductions. We're starting to have things that are sort of in between. And so I think you're going to see, and as we start talking more about tax reform in Congress, which will be an emerging debate over the next couple of years, you're going to see a lot of questions and analysis about this portion of our economy. People that either want to establish a business in order to give money away, or they're trying to change behavior of Americans by producing a product that's made out of recycled material or going to be recycled or something else and sell it on the grocery store shelf, all those kinds of things. So that's what I have to say, but I'm willing to talk about whatever you're interested in and whatever you'd like to tell me so that I can go back and tell the senators or any questions that I may be able to provide some guidance on. Fire away. Yes, sir.
How we heard earlier today that you mentioned the clawback on the money, and we heard earlier today that because it was it's a loan, that it doesn't count. The CBO isn't impressed if you take that money away since it's a loan. It doesn't reduce the deficit. Do you agree with that comment?
Yes and no. I mean, yes, it doesn't score for CBO purposes. That's Congressional Budget Office and our official scoring purposes. On the other hand, I think that we all realize that things don't necessarily pan out the way you expect them to. So think back to TARP, okay? And Congress had to authorize this $700 billion or whatever to bail out the financial industry. Well, at the time, we sort of got scored that that's going to cost you several $100 billion. A lot of those people are going to pay back those loans, but a lot of them are not, okay? Well, as it turns out, now we're down to about $30 billion or some amount that's fairly small from a few of those, but most everyone, the financial institutions, the banks have all paid back the loans. We're still waiting on AIG and a few, Fannie and Freddie, and a few of those that are not directly lending institutions. So, to answer your questions, I think it can be viewed both ways. What Senator Conrad and the Finance Committee and Senator Baucus want to make sure is that there's enough here to jumpstart the industry.